Hello and welcome to this special episode of Omham podcast. Our guest today is Dr. Vishal Chhabra, a highly respected psychiatrist and head of department at Fortis Hospital, Shalimar Bagh, Delhi. Dr. Chhabra has an impressive background, having worked with esteemed institutes like WIMHANS, GTB Hospital, and the Institute of Human Behavior and Allied Sciences. He is the recipient of prestigious awards such as Ravi Pandey Memorial Award, the WPA Fellowship in Child Psychiatry, and the Asian Federation Fellowship. He is a well published authority in the field, serving on the editorial board of Delhi Psychiatry Journal. He is also actively involved in the leadership of Indian Psychiatric Society, where he chairs the LGBTQ task force. As a life fellow of multiple national psychiatric societies, Dr. Chhabra is recognized for his expertise in treating attention disorders, mood disorders, anxiety, and addiction. His work goes beyond treatment for that matter. He is passionate about a lot of things, including understanding how people experience mental health challenges, how medications work in the brain, and the relationship between our biology and behavior. Dr. Chabra, welcome to Omham Talks.
Thank you so much, Aviral, for inviting me. It's a pleasure to be here. I hope we have a good conversation today about ADHD.
And as Dr. Chabla mentioned, the topic for the day is ADHD, understanding anything and everything about ADHD, although it's difficult to cover so much in one go. So we might end up doing a series of episodes on that. And the key focus for today would be living with adult ADHD and managing life when such a situation is out there with you. Joining me in this session would be my colleague Soumya Singh.
Hello.
Welcome, Soumya.
And
Hello.
to start with, Dr. Vishal, uh, I hear all these confusing terms: ADD, ADHD, which includes hyperactivity, if I'm not wrong, along with attention deficit. Attention deficit itself, is it a disorder? And lack of focus, are they the same thing? How do they differ? And as a layman, as somebody who doesn't know much about a disorder per se, but a lack of focus, how do I know if I should get tested for that? Please.
Okay. Yeah. I think this is an interesting question to start with and important. ADHD and ADD are almost similar entities in the literature, in the psychiatric literature, psychiatric textbooks. Actually, ADHD, attention deficit hyperactivity disorder, which may have subtypes. Inattention subtype can be there, or hyperactive subtype can be there, or it could be mixed subtype. So when you say ADD, that's basically attention deficit, where hyperactivity is now, but attention is the main issue. So that's a kind of a subtype of ADHD. And there's a hyperactive subtype and there's a mixed. That's why probably the confusion is there uh, in the folklore, on the internet. But it's actually the same thing. And the reason I'm saying this is the same thing is because no two patients of any disorder have all the symptoms of the disorder. Any disorder, not just psychiatric, but even so, it is possible that some ADHD patients may have more hyperactivity, some may have more inattention, some have more impulsivity, and over time, these symptoms may also change. It's not necessary that they stay the same throughout.
So we see lack of focus as a common thing, right? People are baked differently. There are, I mean, if I go by the way I see the world, there are some early bloomers, there are some late bloomers. It doesn't mean that these flowers would not bloom, right?
Yeah.
So, what makes us think that there is a degree of attention that is needed? And if that is lacking, then it's a disorder. There is lack of attention, there is
Hmm.
attention deficit disorder,
Right.
and then there is hyperactive ADHD, attention deficit
Hmm.
hyperactivity disorder, right?
Right. Right.
What is the difference between the three? I mean, why is one a disorder? Is anybody who is not able to focus, he's going through some sort of a disorder?
Uh, no, Aviral, it's not like that. Uh, what is important for us to remember, understand is for psychiatric diagnosis to be valid, there has to be some kind of dysfunction. So dysfunction becomes an important thing. This is why it is very dangerous to diagnose yourself reading through Google. बहुत बार लोग गूगल से पढ़ पढ़ के अपने आप को डायग्नोस करते रहते हैं, and the reason for that is like when you try to look at, let's say for example of depression, what are the signs and symptoms of depression? Low mood, lack of energy, lack of motivation to do anything. Now on a bad day when somebody is googling that, the person may have all the three symptoms, and person says, oh, I have depression. But it's not like that. That those things have to be present throughout for a duration of 2 weeks or more for somebody to be called as major depressive disorder. So it's not, but that is not written online.
Yeah.
So many times it can be misleading. Similarly, we all may suffer from inattention from time to time. Probably we didn't sleep well last night. Probably we are tired. Probably it's 8 o'clock at night when we're still working. Probably we had a stressful day. Probably we didn't eat properly. Probably there's too much happening around us. So there could be multiple reasons why I'm not able to focus today, or maybe focus for a couple of days. That does not make me an ADHD person. ADHD is much more different than just being inattentive for a few days or few times. Somebody doesn't like the job and staying in the job and not able to focus. That doesn't mean the patient has ADHD. It's just that not liking that job. That's also possible. So for us to say कि किसी को ADHD है, we need to understand that those symptoms need to be present in multiple settings, not just in one setting, for a longer duration of time. And there's also an onset age we can talk about. All that we can look at.
Yeah. As I was saying, there are some in my understanding, I've seen some people blooming early, some people blooming late, right? So, and in general, right, when we look at children or adults, some people get to understand something early, some people don't get it right then. लेकिन ज़रूरी नहीं है कि वो जो फ्लावर्स हैं वो ब्लूम ना हो, कुछ जल्दी ब्लूम होते हैं, कुछ बाद में ब्लूम होते हैं। और कौन डिसाइड करेगा कि व्हाट इज ब्लूम, राइट, कि कितना अटेंशन इज अ रिक्विजिट अटेंशन, ये कैसे
Yes.
डिसाइड होता है? कैसे पता चलेगा कि ये इज देयर अ स्केल दैट इज आउट देयर कि
Yeah, yeah.
प्लीज या
So there are, so yeah, yeah, sorry. So I'm just jumping in. I don't know if that is ADHD. uh, but yes, there are scales for ADHD. There are scales in childhood, and also for adults now they have scales to look at ADHD. But scales are also only one part of the story. Other part of story is taking a proper history, where you look at when the ADHD starts. Almost all, uh, I should say all, ADHD, adult ADHD patients or people who have ADHD, we may not call them patients, uh, starts early, starts when they were young. So usually ADHD starts before the age of 6 to 7 years. That's childhood ADHD or ADHD as we say it. And in that, the child presents with a history of being inattentive in class, hyperactive, indiscipline issues, not able to focus, brilliant student but not getting good grades as the class progresses because child is not able to sit at one place and focus on the studies. Uh, Not able to wait for their turn, like I just jumped when you were asking me question. Uh, those kind of things can. So that's what happens in so three core features of ADHD: impulsivity, inattention, and hyperactivity. These three, or at least two of them, will be present in the child in some form or another, not just in one setting, but in multiple settings. So some kids may be hyperactive in school, but not at home. Some may be hyperactive at home, but not at school. That they are not ADHD kids. Those ADHD kids have to be that at least in two places: school and home, and also social gathering, like going into in playground, outside their homes, or when they're going to other people's homes, or in some functions. Their hyperactivity is there also. If they're present in all three, then it can become moderate to severe ADHD. But at least should be present in two places for a significant amount of time from an early age. for us to call it as an ADHD in childhood. Uh, Continuing this, 85% of them, some say 70%, some 85% is the range, go on to also have adult ADHD, you know. And not all these kids get diagnosed easily, because if the dysfunction is less, or if the family is lenient about it, ki, oh, kids are a little naughty. I was also naughty. Uh, I was also hyperactive. The dadima is saying, the grandmother is saying, his father's also like the same. Why is mom getting so worried? I mean, the kid's mom. And so this is another clue. ADHD runs in families. So there's a genetic component to it. So ADHD runs in families. So this is what also, and so this is why these comments come. So these are interesting comments. So father never got picked up. So the mom, grandmother saying the same, but now the kid is having suffering in classes. That's where the issue comes. Most of the people come to us when the kid starts suffering in the classes. They are not able to focus as much as they should, or they're not getting the grades are going down, or they're getting involved in bad company because class is too boring for these kids. I'm especially talking about moderate to severe. They'll get into gang activities. Uh, they will get into indiscipline issues. They will conduct issues. All of them may happen, and so they will come to us. So they should, and these kids should be attended to, because what will happen if you don't attend these kids? Uh, I'll leave it at right now. I think I've spoken a lot. Maybe we can take another question. So there are consequences of not treating these kids.
Yeah, so there's an ongoing debate in the mental health community that ADHD is now being overdiagnosed, or like I think most of the people feel that they have ADHD, and a lot of people do not come for diagnosis because there are a lot of misconception, and as you said कि लोगों को लगता है कि ये तो कॉमन बिहेवियर है, ये तो कॉमन चीजें हैं, so I wanted to ask about some misconceptions. First of all, the biggest misconception that I have seen is that a lot of people feel that ADHD is not a real condition. It's mostly someone is unmotivated or lazy. And can these two things overlap as well?
Not a real condition, you're saying.
Yeah.
So again, Soumya, we uh, there's no how do I put it nicely? There are no set pat. I mean, there's no set limits of this is how it should be. There
Yeah.
people, the things are on a continuum,
Mm-hmm.
and so it becomes difficult. Now I have a practice of more than 22, 23 years.
Mm-hmm.
I've seen a patient may be very severely depressed, you know,
Mm-hmm.
but
Yes.
all still functioning, and somebody
Mm-hmm.
may be mildly depressed and not functioning, you know.
Yeah.
So
Mm-hmm.
why are we treating mental illnesses? Why are we talking about ADHD right now? Let's look a little philosophically. Let's think
Mm-hmm.
about it. The reason we are looking, let's look at bigger picture, is because we want to help individuals attain a better quality of life. That is Omham also is for. What do you want to
Yeah.
do? You want to help people better quality of life. Now, better quality of life includes a good mental health, a good physical health, social, and spiritual. These are the four aspects or dimensions of health we define these days, right?
Mm-hmm.
Now, if somebody has inattention issues, but
Mm-hmm.
able to push with it, able to organize himself or herself, able to perform well at work and everything, in between
Mm-hmm.
gets lapses, but still picks up and do it. The person won't come to us, and we are okay not diagnosing also, not bothering.
Yes.
What are we trying to do? We're trying to help people, and the person is
Mm-hmm.
already doing fine. So why we don't need to help? We don't have to forcefully go and get. No, you have the disorder, you need to
Mm-hmm.
treatment. So, so this debate happens. We are overdiagnosing or underdiagnosing because depending on what where are you looking this from,
Mm-hmm.
and plus these days everything on the net, our social media is we are bipolar that way. We are polarized so much. We
Yes.
don't see the nuances and stuff.
Mm-hmm.
Uh, there are people who says we are underdiagnosing. We lack psychiatrists. We need psychiatrists every nook and corner of the world, and psychologists also for everything. But do we
Yeah.
need everyone to be diagnosed. Some other says ki, definitely you have to make everyone ill. Because if you
Mm-hmm.
look at this, like, again, I'm sorry, I'm going a little tangential, but if you look at patients who have mental health problems, 1 in 10 have a mental health problem. Okay,
Mm-hmm.
people have diagnosed, 1 in 10 have diabetes. People have hypertension, 1 in 10, cancer, 1 in 100. So if you start
Mm-hmm.
looking at this, that means nobody is normal. Everybody is ill. Is
Yeah.
our societies really so ill? Is everybody falling sick every day? So
Mm-hmm.
if you look from that point of view, you think we are overdiagnosing.
Mm-hmm.
Whereas people who suffered, imagine I'm a 28 year old soft tech developer
Mm-hmm.
and I'm losing one after another job. I don't have a very good personal relationship. I couldn't find a girlfriend or something.
Mm-hmm.
Uh, I keep delaying my tasks. And at the age of 28, I remember I realized, or I've been told, I had ADHD. And I see,
Mm.
oh, I suffered for so many years. I was
Yes.
ridiculed. I found it difficult to manage everything.
Yeah.
We are underdiagnosing ADHD.
Mm-hmm.
So
Yeah.
this kind of dichotomy comes because we are not able to see a bigger picture. It's how
Mm-hmm.
and where we are approaching the subject from. That makes all the sense. If I'm a
Yeah.
psychiatrist, I would say, hey, we are underdiagnosing. We should diagnose more. There should be more psychiatrists. If it is somebody who's anti-psychiatry,
Mm-hmm.
they'll say, oh, you're overdiagnosing. You're making everyone get diagnosed so that you can push your pills.
Mm-hmm.
You know, so these are we have to have nuances on our discussion. This is what I'm trying to bring in here
Yeah.
with,
Yeah.
with you guys.
On that note, what I have seen is that with time, awareness has increased. Of course, as far it doesn't come independently, right? Awareness doesn't mean all knowledge is right knowledge.
Mm-hmm.
So availability to information has increased. So and on top of that, something like COVID that recently happened, right,
Mm-hmm.
where people ended up facing issues, not just physically, but there are a lot of mental health issues that came to the fore.
Mm-hmm.
So thinking, I mean, just uh, pushing it under the carpet in a way that, you know what, we've all become too paranoid. We've all become looking as a society that everything is wrong now, right? Isn't this a result of more awareness and more incidents being visible now in the experience?
So yes, when we get aware of something, um, our tendencies, our minds start overworking, and we get scared, we get worried. That's a human brain tendency. Now, if you diagnose you have a disorder, let's say you have diabetes, you'll immediately get scared. And this is what the awareness is doing right now. Also, uh, the awareness of in the society, as the media is exploding, as the knowledge is exploding, people are diagnosing much more, and they're getting scared and they're getting worried. Uh, so, so much of disease, there's so much of issues. I may be suffering. That's what I'm saying. A lot of times people come to us googling themselves with disorder. It's not a good thing to Google yourself.
Yeah.
The Google algorithms will tell you if you have pain abdomen, first diagnosis will be cancer. Second diagnosis will be need for surgery, and
True.
last diagnosis will be just some gas. You know,
Yeah.
because why? Because the algorithms are based on what people check more, click more, and people trend to deviate or gravitate towards negative information. That's why social media outlets and news media outlets are filled with negative news because it attracts people's attention. It's an evolutionary phenomena. I keep saying it multiple places. It's evolutionary phenomena. We get attracted to negativity because that's self-preserving. If we're not focusing on our environment, so that if we can filter the threats, so we can scan for threats, so our mind automatically goes for negative information. Same thing is reflected in social media. Same thing is reflected on the internet, and that's why when you Google, you get a lot of negativity towards you. You overdiagnose yourself. So we should not get too scared about it. We are living in one of the best times in the history of known mankind, known history of mankind, because we're so privileged. Like right
Yeah.
now,
Yes.
we three are talking probably from three different locations,
Very true.
and from the comfort of our homes or offices. Our
Yes.
ACs are working, our tummies are full, and we are just enjoying and having a conversation. We are talking a difficult topic, but we are having it in a very comfortable place.
Yeah.
There's no threat to our lives. There's no threat from any animals. There's no threat from the environment right now. So we need to understand it. We take it for granted. We need to appreciate all this also.
As a human being who is living in the world, who could be a potential patient, right?
Hmm.
How would he come to understand, or what would be the cue for him to even go to a doctor, uh, or get tested for ADHD? Uh, how would I come to know, right, that it is something that I need to? It's actually a disorder that I need to go visit a doctor for.
Okay. Uh, so one of the major, why would somebody go and Google about any issue? Like, why would you Google you have a toothache? Because when you're having a toothache, right? That's all you'll Google. You're not Google right now. You're not Googling a lot of stuff which is not happening. So that is when somebody starts feeling uncomfortable with their lives, you know, maybe it is, as I was mentioning, taking an example, a software developer. I was giving that example, right? If that person is not able to uh, focus on the work, or getting reprimanded, missing deadlines, uh, uh, feeling depressed, feeling anxious, negative thinking. Uh, so I'm trying to think, how do I mean, there are multiple ways people can come to me. Let me try and give an example. Let's start with, most commonly patients come to us with a history of depression or anxiety, right? So depression could be of not able to do the work, or feeling failure in life, or anxious because the patient is missing deadlines despite knowing, Doctor Saab, I know I need to get up and do it, but I'm just postponing. Now this is too much. Things have gone beyond repair. I don't know why I can't get up and do the work. I know I have a deadline in 1 week's time. I know tonight I should sit and do it, but I don't. I just come tomorrow, then tomorrow, and it's tomorrow morning. So earlier I used to do it, doctor. This is how I was been studying. I would study all the last moment. I'll finish all my tasks, assignment the last moment, and get through. And I used to get the thrill of it, or the enjoyment of it. And I said I could do it, and I felt. But now in job, I'm finding it difficult. I'm not able to manage. So much to happen because now I'm living alone. I have to also take care of my family, after my cooking, my clothes, my groceries, my job, and I have to do all this assignments. I can't. So the person is feeling overwhelmed with the work, which others are not. This is one sign you may have ADHD, and person has come to us for depression. We treat, but we realize, we understand, and we see depression is better now, but patient is having this issue because patient has ADHD. So ADHD patient may not come to us for gain attention, they come to us for depression. Similarly, for anxiety, patient may have generalized anxiety disorder, but when you go dig deeper, you may find an ADHD sitting there, and that's a person anxious all the time because they're not able to do tasks. Or patient may come to me, which we have not talked till now, substance abuse. So a lot of patients who do alcohol or cannabis or other harder drugs also, when you get into the details, you see some hint of ADHD in many of them, and that is an important thing to remember. So ADHD uh, can be precursor, or can be partnering or comorbidly with depression, anxiety, bipolar disorder, substance use disorders, and other conditions also. So this is how our patients come to us. And ADHD is usually underdiagnosed or not diagnosed in these people. And to answer your question in a single statement, dysfunction, dysfunction in your life,
Mhm.
dysfunction either in your personal life, that is,
Mhm.
you're not able to discipline yourself, you're delaying stuff, still not affecting your job, but it's affecting your personal life.
Yeah.
Dysfunction in your social life
Mhm.
in sense, you're not able to focus with your partner.
Yeah.
You getting you having issues with the partner is because partner is complaining that you're not listening to him or her. You're
Yeah.
just zoned out. You're not able to focus on the relationship. You're getting bored easily. or dysfunction in your office life or work
Yeah.
life,
Yeah.
you know. So one of the three dysfunctions, you should seek help with a psychiatrist. Don't diagnose yourself. Fine, if
Yeah.
you want to go get a self-assessment done online, fine. But don't label yourself an ADHD till a doctor or a psychiatrist tells you that you have one.
Yeah. Beautiful. I mean, that's an easy one to for all of us to apply on us. Before you go to Soumya's question on the diagnosis part of it, uh, is it uh, is it so that mostly the patients who come for ADHD, that's what I hear. This is what I understand from what you were saying. They would come for depression or something else, and eventually they may be diagnosed as ADHD, or do usually in practice, in your experience, the way you've seen patients coming in, or do they come in looking for an ADHD treatment, or thinking that they might be having ADHD?
It's a good question. Most of the people who come to me, they don't know they have ADHD. It's discovery. Either that I discover them when I'm treating a kid, and I see father also has, or mother
Yeah,
also, and I tell them, "Kid, I think you're also suffering from this issue, and you need to take care of this. You need to find this out." You know,
yeah,
yeah, I see that in you also. And what they themselves realize when the kid is getting better, I also have these issues. I suffered, but I managed somehow because
yeah,
human brains have a huge capability of managing things.
yeah, yeah,
So
yeah.
so one that is one way, or now some younger folks, 22, 23-year old, 24-year, who have read and gone through all this stuff, some inkling they have, then they go through awareness videos, and so much information happening, and then they come to us.
Yeah.
Uh, some there's an extreme group also who says, "Ki, I have ADHD, just give me the medicine," because medicines you don't get easily, on your own.
Hmm.
That's a rare group or lesser group, but these are the three ways people come to us.
Hmm.
Yeah.
Yeah, so when diagnosing as a psychologist, I feel that in adult ADHD assessments, there's a lot of self-report.
Hmm.
So because someone is already coming from a lot of information, and people like I have talked to ask questions what they have read on Google, and
Hmm.
they come with a diagnosis that they know that they feel that they have ADHD, and they just want to prove that they have ADHD. So how does one go about dealing with that? How does one make sure that the diagnosis is correct and their own biasness is not coming into play?
So there are criteria we need to look at.
Mm-hmm.
Uh, what See, for somebody to be diagnosed, there are rating scales, and now there's a clinical interview. Now,
Mm-hmm.
clinical interview will look at the features the patient is having of ADHD and
Yeah.
the dysfunction associated with it. Why we
Mm-hmm.
need to look at dysfunction is because people may over-report
Mm-hmm.
or people may
Yes.
underreport. If they overreport symptoms but you don't see that with a dysfunction, then you may think about
Mm-hmm.
that. Or
Yeah.
you check whether you have dysfunction because patient may not remember, realize, or recognize that
Mm-hmm.
they are having these problems and this is affecting their life. Let's say nobody will come to me and say, Doctor Saab, I have changed. Let's say a patient with ADHD. I said, do you have difficulty sustaining relationships?
Mm-hmm.
Now, this is an important question because
Yes.
this can happen at multiple levels. This can happen about two major instances. It can happen with borderline personality disorder patients. It can
Mm-hmm.
happen with an ADHD person. Now, how
Mm-hmm.
do you differentiate? And that is the job of a psychiatrist by going clear for more interview, more detailed, nuanced interview. Also, you can look at whether they coexist. Whether this person has borderline traits and
Mm-hmm.
also ADHD traits. So this
Yeah.
becomes a lot of because our psychiatric disorders do not live in silos. They're not just very neatly defined separate disorders. Symptoms can kind of overlap. Like
Mm-hmm.
autism symptoms also overlap with ADHD.
Mm-hmm.
Patients
Yes.
may have autism also. So there's the now adult autism also. We're not talking about today, but that may overlap with ADHD also, adult ADHD, and that can happen in childhood also. There can
Yeah.
be IQ issues,
Mm-hmm.
intellectual disability issues also. Patients may
Mm-hmm.
have very high IQ also. You know, Patients may have personality traits also.
Mm-hmm.
Patients may have a mood disorder also. So a
Yeah.
lot of things can overlap. So it
Mm-hmm.
becomes very personalized, individualized from one person to another, what is person is having, and you then treat accordingly.
Yeah.
You know,
Mm-hmm.
and it's important not to label everything. It's not important to have as many, but it's for our understanding so that we can give a more comprehensive and a better treatment to an individual.
Yeah, yeah, agreed. I do feel that there is no clear cut, not always there's a clear cut diagnosis. And if we go after the diagnosis, uh, we do not focus on the symptoms and treating the symptoms rather
Yeah,
than focusing
yeah.
on a diagnosis. It is a very individual experience, but uh, men get diagnosed with ADHD more often than women. Uh, though it is an individual experience, why recently it is coming up that women also have as much ADHD as men. But what could be the reason for that difference, or how does it show differently?
So I think let's go with from the childhood first. Is it okay if we go from childhood?
Yes.
Yeah.
So let's go from childhood. So for boys, ADHD is diagnosed much more than girls because boys are much more physically naughty.
Mm-hmm.
So the physical activity is much more visible to parents and teachers and others. So they get picked up faster.
Mm-hmm.
There are cultural reasons also. Boys are given much more freedom to go out and do all kinds of activity than girls do. You know, so culturally and also because boys are more physically active, they get picked up faster. Like indiscipline, girl may do indiscipline in a quieter way. Boy may do it in a boisterous way, and they get picked up faster. So this is one reason.
Mm-hmm.
So woman can girl, so they get underdiagnosed. Uh, but it also as we grow, hyperactivity goes down with age, and inattention usually sustains. So most adult ADHD patients come not because they're impulsive, they can be, not they're hyperactive, they can be, but mostly because they're inattentive. That is what is affecting their jobs and lives. But as in kids, you have more hyperactivity and impulsivity.
Yeah.
Three or four, let's say a third class or second class kid, parents will not bring keys, not sitting and reading for 4 5 hours because the kid doesn't have to. They will come more in terms of inattention, so with hyperactivity or doing impulsive behavior. What is an impulsive behavior? Suddenly blurting out an answer, suddenly jumping from somewhere, suddenly doing something without even thinking they have to do it.
Mm-hmm.
And those again seen much more in boys, and that's why they get picked up faster than girls.
Mm-hmm.
Uh, but now, and one more thing. Uh, Socially, historically, boys, as you know, have been given much more preference than girls,
Mm-hmm.
and boys were considered much more valuable than girls, and that's why if there's a similar problem happening with both boys and girls, family will try to invest more money or more time in taking care of the boy than the girl. Sad but true. Now things are changing. Now we have single kids families,
Yes.
and girls are given much more importance. So girls are also being picked up, and girls are given much more freedom than boys had,
Mm-hmm.
and that's why. And similarly, awareness. Almost equal number of women girls are also entering the work field as boys do and men are doing, and that's why we are seeing much more parity now, and ADHD being diagnosed in both of them.
Yeah, yeah, and the cases are increasing now for women as well.
Yeah,
So
because of
it's
the
it's
more awareness and similar kind of roles.
yeah.
Um, because you have to do. See, we have to realize
Mm-hmm.
most of our work these days is cognitive work, not
Mm-hmm.
physical work. If you have
Yeah.
ADHD and physical work, it's better, no? You're
Mm-hmm.
much more active. And this auntie who cooks 10 things together, maybe
Mm-hmm.
ADHD but better. She's doing better. She's doing much more. But
Yes.
when you have to sit and do a task, you have to make a project, you have to code for something, you have to
Mm-hmm.
see some, you have to make some slides or PPT, and if not able to focus, you're delaying it. It may not be functional, so it may be causing affecting, and that's why it is being picked up in girls much more than uh,
Yeah.
uh, now than before. Another example I can give you.
Mm-hmm.
A little the reason I'm just going out of ADHD again. Social
Mm-hmm.
anxiety disorder.
Yeah.
right?
Mm-hmm.
Now, if a girl had social anxiety disorder 10 years, 20 years before, now
Hmm.
so that is good. Sharam to gehna hai औरत का.
Yeah.
This is used to be said in Hindi, right? It's a blessing. It's a good thing for a girl. It's a
Yeah.
girl should be shy. But in
Yeah.
today's world, a girl shy will have so much difficulty being a sales girl,
Yeah.
becoming a manager. How will she interact in the workplace? So she will also come for treatment. Earlier, that girl will never have to come. But
Mm-hmm.
the thing will be that our mom speaks less. She's not
Mm-hmm.
that social. She keeps to herself, but she's good with us, and that's good thing. So
Uh-huh.
same thing, which was a disability, which is disability now, was considered as an ability before. Now the girls
Yeah.
have been told you are not at all shy. You should be a little shy.
Yeah.
So, on that point, I would want to delve further on the diagnosis and misdiagnosis of ADHD. So, I was reading a report recently, and it came across in that on an average, an adult sees roughly 3.3 clinicians and goes through 6.6 antidepressant trials before being diagnosed with ADD. Why is it so hard to diagnose ADHD or ADD?
So I joined psychiatry in 2000. When I joined psychiatry in 2000, ADHD was just coming up in India as a training. And adult ADHD, there was no concept. There was no concept, not taught to us at all. So all of this stuff has come later because it is we are not taught to look for these things. We you don't when you what your mind doesn't know, your eyes can't see, right?
Yeah.
And that's why the delay this has happened. This awareness has happened lately in last 10, 15 years, last 5 years. COVID also brought a lot of focus to it. So I think after that, the pickup has been much more because we did not know. Like autism is much more prevalent than before. Autism is now much more common than it was. It used to be a rare disorder. Now it's much more.
Hmm.
Uh, you know, because of the better awareness, things are being picked up better now. And that's what
Hmm.
it was not. And the reason you have these statistics because where do you get statistics from? From research.
Yeah.
Research happens usually retrospective. So this research would have come from by collecting data from last 10 years, 5 years, and that's why this you see this kind of a delay.
Yeah.
Also, uh, if ADHD is not prominent, it's difficult to pick up till you look for it. Like I am interested in looking for ADHD in my patients.
Yeah.
So not everybody may be, they may be more interested in looking for something else. So I keep looking for it in patients of substance use. Whenever a substance use patient comes, I look for ADHD. A patient who has frequent change of jobs, I keep looking for it. Suppose a 31-year-old boy has come, never had a stable career. I look for ADHD, not for depression.
Yeah.
Once I rule out schizophrenia and other stuff, I will look at why is why is this boy not able to maintain the job? What is happening? So I look at ADHD. I think this is there. So better awareness helps in picking up, but because that awareness is spreading slowly, not part of the curriculum initially, it's being picked up later. And also one more thing, just this thought came to me. ADHD is not a life-threatening issue. So the clinician may not be focusing on that, but his depression can be a life-threatening issue. May have suicidal ideation.
Yeah.
Schizophrenia is so that's why probably depression gets picked up faster and treated much more vigorously than an ADHD will be.
Yeah. And
And the kid that may person may say he's lazy, like you were saying, lazy hair,
hmm.
or he's still having prodromal, not prodromal, sorry, and residual symptoms of depression, and that's why the kid is not doing better. Instead of
Hmm.
focusing what is the issue, it could be ADHD itself.
Hmm. And I've also read that a lot of times ADHD gets misdiagnosed as mood disorder.
Hmm. Hmm.
Are they similar? What is a mood disorder? I mean, and how are these kind of overarching on one to the other?
Yeah, like I was discussing Soumya some 5-10 minutes before. Our symptoms overlap. See, how are psychiatric disorders diagnosed? We don't still have the clear understanding of how brain works. Brain is really, really complex. So what we have done is our diagnoses are more descriptive. We look at how a person behaves normally and what happens to the disorder, what happens to the behavior if the person becomes abnormal. What are the changes in that behavior? We look at that, we we capture that, and based on that we make disorders. So in a mood disorder, the primary focus is mood, not thoughts, mood. So mood of that individual is not uh, say normal, quote unquote normal in the sense like we all suffer low mood, we suffer high mood in a day. But in a
Yeah.
mood disorder, the mood will stay low for days or weeks or months together. For a hypermanic or for a manic or for a hyper mood or a high mood, again the mood may stay uh, high for days and weeks together, which is not normal.
Yeah.
Mhm.
So the mood is disturbed. That's a mood disorder. Not so when mood gets disturbed, your behavior also gets disturbed. So you may have sleep issues, you may have concentration issues, you may be spending a lot more money or less money, you may be eating more or less, you may be, you know, talking to more people or less, depending on the mood state. So this is where a mood disorder. And in adult ADHD, uh, the reason they may be misdiagnosed with mood disorder is because the person is missing deadline one after another,
Mhm.
lost a job or on the brink of losing job or under constant criticism from parents or spouse or bosses, and person feeling depressed about it. Why everybody is criticizing? Because the person is not able to understand ki I am having this disorder, or they are not able to understand he's suffering from this disorder, and that's why he's not able to do the task given to him. That's why he's delaying. And people think you're lazy, you are not motivated, you're not a good person, that kind of thing. Why you're so careless? I saw you watching movie for 3 hours, you have no problem concentrating on a movie, but you can't do this task. You know, so, so those kind of criticism, those kind of things affect that individual. Person is coming to us depression, and that's why you get treated for depression, but nobody's looking at the underlying. So this is how ADHD may be misdiagnosed as depression, or it could be comorbidly. ADHD is the root cause, and depression is on the top of it. Yes, so
Yeah.
ADHD is there and the top of it. So it could be that. That's why people get misdiagnosed. Similarly, people can get irritable also, can hyper or can get upset also. That can
Mhm.
also happen with ADHD. Let's say an ADHD person says, I am getting a kick by drinking coffee. So drink a
Yeah.
lot more coffee to get the work done.
Yeah.
Drinking coke, sorry, doing cocaine or
Yeah.
doing, drugs to make the mind gets more focused. I get hyper focused. I can do this.
Yeah.
And that may
Mhm.
also trigger a mood disorder. So things can
Mhm.
be complicated that way.
Very interesting.
Yeah.
Yeah.
Interesting. Uh,
While I'm talking to both of you, I'm realizing how complicated this whole thing is. Explaining it to a
yeah.
layperson, it's not easy. It's
Yeah.
not
It,
as easy
it
as
is not, but
making it.
a lot of things you're saying are actually very revealing. I mean, where you mentioned that given that it's not a life-threatening situation and we have a bias towards treating something, so the thing which is, I would say, not so serious, right, in its effect, that gets lesser priority compared
Yes.
to what one is looking for.
Okay, so moving on to the next question around treatment. Uh, for ADHD, what is the treatment look like?
Okay.
Mhm.
So, so the treatment for ADHD involves medications and therapy both.
Mhm.
Um, and therapy not just for the kid, but for probably the parents also. I'm talking about childhood
Mhm.
ADHD, but even in adult, the spouse or the family member also needs to be educated. That psycho education, we call this psycho education,
Mhm.
educating the patient and the family about the disease. It gives itself a lot of confidence and control over the disease itself, because you understand why is this happening to me and what can we do to reduce it or prevent it and change it. So that's called
Mhm.
psychoeducation. So psychoeducation becomes a very important cornerstone for almost all psychiatric disorders. That's number one. Number two, medications. There are very good medications available, but also a lot of more than the medications, the literature, the scary stuff on this on media and on the social media is much more very addictive, and it causes growth retardation. You cannot leave and all that stuff. I mean, these are all actually exaggerated claims of its damage, but the way can be very, very fruitful to people. So there are two types of medication: stimulants and
Mm-hmm.
non-stimulants. Stimulants is counterintuitive because if kid is hyper, already stimulated all the time, why are you giving a stimulant to a kid who's hyper? That doesn't make sense, right? Uh, so if somebody is not sleeping, you're giving the person more coffee. How does that make sense? So here, the reason and logic I'll come to in a minute is so the stimulants and the non-stimulant medications. Now, stimulant medications are not addictive if started at an early age, if they are supervised well by the doctor. The drugs who get the drug these drugs can get abused, are abused by people who are doing it in black market and who are basically usually adults or late teens when they trying to get a kick out of this. That's a separate issue.
Mm-hmm.
But themselves the drugs are not addictive as such, and I've used them and tapered them off in the kids. It's not that the kid continue lifelong. So these medication need not be taken for lifelong, only for few years, and most of the kids get better. So,
If
and
what
third
would be
is
an
therapy.
example of a stimulant
So
medication? Huh.
methylphenidate is a stimulant medication. You know,
And you're saying
uh,
this is uh, this is not
so
something that non-addictive.
yeah, yeah. So people can get addicted to anything.
Yeah,
uh,
yeah.
it's how you use a drug, and we need to be careful also. So that's why this is a controlled substance. You do not get it in open market. You can't buy it over the counter. In fact, methylphenidate in India is very restricted. In Delhi
Hmm.
also, you get maybe in one or two places, not
Hmm.
everywhere. There are
Yeah,
with hundred thousands of shops in Delhi, medical shops,
yeah.
chemist shops, but you get it in one because it's a controlled substance.
And
So
these are
that's the
prescription
reason.
controlled substances,
These
so
are,
they are prescription drugs.
yes, only by prescription, and only in certain quantity because they have to maintain. The reason for
Hmm.
that is that they can be misused. So
Yeah.
they can be misused, but they're very effective drugs for kids. But people use it for other reasons. That's a separate issue. Uh,
Hmm.
so, and then there are non-stimulant drugs like atomoxetine, which is a very
Yeah.
good non-stimulant drug. I use a lot more than the stimulants, and they're also very effective if used on time, used properly, used adequately. Used on time, used properly, used adequately. All three are important things. All three. Why I'm saying this is,
If you could elaborate, sorry, this is kind of now I'm
yeah, yeah,
becoming
yeah.
more aware. Could this be ADHD?
No,
Now, in this, you were mentioning that stimulant drugs, right? It's counterintuitive that why they are used here.
yeah,
Why are they
yeah.
used? I mean, because it is
So,
counterintuitive.
yeah, yeah. So the theory goes like this: that these kids are deficient. The brain is deficient. For a normal kid, if you play a little bit, let's say for half an hour or something, your mind gets stimulated enough to calm down. You
Yeah.
got enough dopamine to relax. For those ADHD kids, they need much more stimulation for the brain to produce the same kind of dopamine.
Okay.
So they have to be much more hyperactive. They have to seek much more excitement to feel normal, to feel good, to feel calm, to feel happy.
Hmm.
That's why they are all over the place. That's why they're running all around. That's why they get into risk-taking behaviors. That's why they get into novelty-seeking behavior. This is where I can add why it's important to treat kids from an early age. If we treat ADHD kids on time, they we escape, we help them escape from a lot of bad things which can happen to them.
Hmm.
Low self-esteem, low self-esteem. We didn't talk about it. Low self-esteem can happen because these kids get reprimanded all the time. You're an idiot. You are mischievous. You're a bad boy. Get out of the class. Stand outside the class. Punished by teachers. Punished by parents. So the kid says, "Yeah, I am bad only here. Nobody
Yeah.
appreciates me." So kid
Yeah.
feels bad. So low self-esteem there. Uh, then these kids seek similar kids, so they become into a gang. They all do more indiscipline because they together they do much more fun to get
Yeah.
excitement. Bursting crackers in the school toilets, throwing paper balls on teachers. These are ADHD kids. Masturbating in class. You know, so doing riding, driving, driving bikes very high speed. Uh, those kind of stuff, again, getting wanting to seek thrill all the time, that also push them towards drug abuse also, because drugs or cigarette smoking, alcohol at a 13-14 year old giving them a high. So these ADHD kids get drawn towards these kind of stuff. So treating them early helps brain calm down, not wanting to seek extra stuff to get the high
And
and to feel
these
normal.
being in this stimulated state for longer times, maybe due to the drugs, it
Mhm.
doesn't have any physiological impact on the body.
No, 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 no. So that's why we start. So we start slow and slowly go up, so that the body gets adjusted to the drug. Any new drug you start, body needs to get adjusted to. For that matter, anything you start an exercise also, you start yoga also, you start meditation also. You go slowly, no. First day you don't do everything. You just start with 2 minutes, 5 minutes, and slowly you build up. Same with the drug also. So slowly,
Yeah.
slowly you build up. You check most of the most. You have to remember, most of these drugs are thoroughly tested before coming to the market. They go through a trial of 6 to 8 to 10 years before they come to the market. So it's not that they suddenly cooked in a lab and brought to the market the next day. It's not like that.
Yeah.
They're rigorous, and they're rigorous feedback mechanisms. Anytime a drug is found to be affecting the population negative way, the drug gets withdrawn from the market. So
Mhm.
there's a feedback mechanism also happening along. So they're very safe, provided they're given an expert, you
Mhm.
know, provided they're given at the right time, at the right dose, for the right duration. All of these are important.
Mhm. You were mentioning about non-stimulating medication.
Yes. So the non-stimulating medication also helps the brain uh, get that balance of neurotransmitters, which are important in calming the brain down and keeping these kids focused. The benefit that they are not stimulating the brain, but they're indirectly helping the brain uh, level up these neurotransmitters, so that the kid or even an adult can focus. So this is the benefit of them. They are longer acting drugs. The atomoxetine is a very good drug. I use it a lot more, and they can be used in combination. So you can have a combination of uh, a stimulant with a non-stimulant also. You can also look at an underlying depression, an underlying anxiety disorder, and especially in adults, and try and treat that. You know,
Mhm.
you should also try and treat a comorbid substance use. Maybe the person is doing THC or doing alcohol or doing something else. You need to treat that also along with the ADHD. That also goes part with it.
How does a doctor usually decide whether to go for a stimulating medication or a non-stimulating one, or how to have the mix?
Uh, See, again, it's a personal choice. Uh, the first line is stimulant drugs, uh, but because of my experience of facing a lot of resistance from parents and they being uncomfortable, nobody wants a 6 or 7 or 8 year old kid or even adult who reads a lot on the online. So I started
Yeah.
with a non-stimulant drug that improves the acceptance. They help, and once they are much more confident, they build a trust with me. They understand that I'm here to help them.
Yeah.
Then to build up on that, it's easier to do that. And then we can start a stimulant drug also if it's required. This is my way of going with it. Sometimes kids may be very hyperactive, so disruptive that the school's threatening to kick them out of the school. That can happen. So there, a stimulant drug is much more effective. If a person has come just a month or 2 months before exams and not able to focus at all, and this it's a tenth board exam or 12th board exam, and on the verge of failing, the stimulant
Mhm.
drug in that case. Similarly, somebody who was an appointed assignment has come to me later and they may lose their job. then I'll use stimulant drug as a first possibility. So again, depending on the circumstance and the situation.
In case of adults, Dr. Vishal, uh, uh, this changes. I mean, you have more liberty, is what I feel, right?
Yes,
To
yes,
in
much easier.
finding the right mix instead of going in a more, I would say, massaging way for the parents' emotions and I would say choices.
Yeah, because uh, not exactly myself, but they get worried, and it's also okay not until the child is very disruptive.
Yeah.
We need not start the stimulant drug right away. We can start it later also. We can start with a non-stimulant drug. Again, that depends again from the situation to situation. And for adults, yes, when they are well prepared, they have suffered enough, they are much more accepting of a stimulant medication.
And this is a time bound medication, or it's like a, so I have thyroid medication which is going on for such a long period, right? So I'm controlling it somehow. So is it something that is time bound with phasing out of some sort, or does it continue for a very long period?
So, in my experience, I have not used them for very long periods of time, 2 to 3 years maximum. I've used somebody for 4 years. I've not followed the patient after that. Maybe they became better. That's why they dropped out.
Yeah, yeah,
Most of them I've known the kids get better. Somehow, brain gets more mature. We still don't. I still don't understand. The brain gets either more mature or finds a way to handle this inattention. Brain is very, we all know neuroplasticity. Brain is
yeah,
very, very flexible, malleable. All we need to do is give a little support to the brain, and brain does wonderful. So these medications are itself are a support to the brain, you know and it's the brain which treats. We just support the brain. That's very
yeah,
important for us to remember. That's very, very
yeah,
why this is very, very, this is very deep stuff to say. This is very deep stuff to say. Why I'm saying this is because sometimes, again, I'm going a little digressing in dementia and severe dementia, where brain cells have died. Brain
yeah,
is all brain. There's huge chunks of brain which has disappeared. You give medication, medications don't work because there's no brain for medications to work. Brain is not there enough now. There's not enough brain material there. In severe dementia or profound dementia. So it's the body which heals, the brain which heals. We only support. As doctors, we are not uh, we're not creating something new. We are only utilizing the brain's ability or body's ability to get better. We just support it. We promote it. We need to remember this.
yeah,
While we are talking about the treatment aspect of ADHD, and we discussed both for uh, kids and adults,
Mhm.
what more ways are there for treatment, and how can ADHD be treated holistically for adults? For in terms of uh, kids, I understand the therapy aspects, like what are the things that we have to target for kids. Mainly it's behavioral therapy. We train them, we condition them, change their conditionings. But as an adult, there are a lot of, as we discussed, comorbidities, and uh, a lot of other aspects that needs to be taken care of. So uh, for that treatment aspect, what how is it different?
So, for adult ADHD, in therapy, one is, as I mentioned before, psychoeducation is very, very important.
Hmm.
Psychoeducating the person about the condition the person is suffering from, so that he understands the what are the symptoms of the disorder, which are how it affects all parts of various aspects of his or her life. And
Hmm.
then therapy, depending on what problems. So some of these clients may be suffering from low self-esteem, low confidence all their lives. So help them boost their self-confidence, remove the
Hmm.
negative self-images they have, or reduce the negative. They may have issues in organizing their life. So teaching them ways and methods, and making them responsible for it. So organize, help with the therapist help. We can help time their life, time their day schedule, organize their
Hmm.
life much better, uh, put deadlines, put timers, those kind of stuff. So
Mm.
organization, uh, some people self-esteem issues, some may have
Mhm.
relationship issues. So giving them
Yes.
relationship advice, how to maintain better relationships,
Mhm.
what is the spouse or the partner is looking for you in your relationship, and how you can improve that. That aspect can be covered. Some of them, these patients may have still have thrill-seeking behavior or some kind of addictions. We counsel for that, how to manage that. That also becomes an important aspect. So depending on the issues of this ADHD patient, we try and cover them in various therapies. And they also may require a therapy with the partner. We may also have to liaise with the HR to help this person cope better with the work environment. Maybe give a work which is much more important or helpful for this person, where the person can do better. You know, let's say there's a night shift, and we've seen this patient do much worse with night shifts. So
Mhm.
avoid the night shifts. You know, uh, avoid alcohol, those kind of things, help them have
Yeah.
a better daily routine, better daily diet, maybe meditation, maybe yoga. All of them can be, depending on, again, the individual needs of the person.
I mean, you have seen the effect of medication on people. What would you say the relevance of therapy is for an adult ADHD patient?
There's a lot of relevance because we need to teach this individual to get control over their own lives, you
Mm-hmm.
know. So it is not about, again, it's not a life-threatening condition, but we need to improve the quality of life of that individual.
Mm-hmm.
And in today's corporate world, unless you're organized, unless you are much more disciplined, how would you find success?
Yeah.
And that is very important
Yeah.
for us. See, the best example in the world for ADHD I can think is Michael Phelps, the American
Mm-hmm.
swimmer, which has the
Yeah.
maximum number of golds. He has more gold than most of the countries in the world have in the whole
Yeah.
history of Olympics. Yes, he was an ADHD kid. It's how he's put this
Mhm.
hyper focus, because ADHD people can be very hyper focused also.
Yes.
Uh,
Mm.
and because again, as I'm speaking with you, I'm realizing how vast the topic is myself. It's not that easy. But Michael has a very good example of how an ADHD kid can go on to be a world class champion. You know,
Mm-hmm.
so therapy is very very important for these. Not, I mean, if you look if you look at the media, social media is full of ADHD coaches. What are
Mm-hmm.
ADHD coaches? They're basically therapists, but they're
Mm-hmm.
not actually trained therapists, but they are people who have suffered ADHD, have seen people, and they're basically helping and coach these individuals. Uh, Kind of, it's like ADHD person will do better if there's somebody else who asks this person how responsible you are, or a commitment partner, you can say, like you have a gym partner or a commitment partner or a race partner, that kind of a thing. That's what these coaches do.
Yeah.
So
Mm-hmm.
therapist teaches the person to do this on their own, and
Mm.
if they can do it, then they can do better.
Yeah.
On that note, is it possible to have a treatment plan that doesn't have medication at all?
Yes, I said it without even hesitation. Yes, definitely possible, depending on the severity of the symptoms. Even for all kids also, I think I didn't mention that. Not all children of ADHD require medications. Some of them do manage just with with changes in diet, or changes in behavior itself helps. Diet also plays an important role. I forgot to mention that also. So
Hmm.
junk food, sugary foods trigger ADHD in kids a lot. So just controlling that diet also helps.
Yeah. Just having
Similarly,
the stimulants would impact. Stimulant food would make
yeah,
the more stimulant.
So,
I mean, the sugary foods are tend to increase, and so fast foods also tend to increase the ADHD symptoms, and that helps. And for adults also, we need to be careful about the same.
this reminds me, in fact, this brings out the point about the neurobiology and genetics of ADHD. I mean, the role of genetics. So, what what are the factors, I mean, that cause this? I mean, what is it that what is it that brings out ADHD in people? I mean, what are the factors behind it?
So one you mentioned already. So genes, as I was saying initially, also it runs in families. So genetically, there's a component of ADHD. There are other theories why ADHD happens. One, if you look at how our playing spaces for kids have shrunken over time.
Say that once
Now,
again.
playing spaces for kids have shrunken over time. Like we all live in flats. Most of all the audience must be watching must be in tier one or tier two cities, metro cities,
Yeah.
and maybe abroad. But the current way we live is in our rent in our apartments. So apartment spaces are small. There are a lot of expensive stuff. Kids wants to explore, wants to run around, wants to break stuff will happen. We'll say no, don't do this, don't do that. So that also affects. So our environment is also affecting. Fast. There are a lot of data which comes with fast foods affecting sugary foods. A lot of our fast foods have actually sugar content in it. All that also affecting these kids, uh,
Mm-hmm.
harming these kids and having ADHD symptoms. So genetics, environment, and foods. You know, but still understanding brain much more. And believe me, Aviral, uh, in next 10, 20 years, as we understand brain more, our understanding of almost all psychiatric disorders will change
Yeah.
drastically. But as of now, this is what it is.
Today we are living in the era that is the most comfortable, most accessible in uh, uh, the best era that we are living in,
Hmm.
which also brings a lot of distractions with it. So we have a lot of things accessible to us, but at the same time we are constantly distracted. We have so many things around us to be distracted. So because we are living in an environment where our attention constantly keeps on shifting from one thing to other, uh, could this be a contributing factor into ADHD symptoms? And like people, could this also be causing some form of ADHD in people?
Uh, yeah, and I think this is a very good. I think there should be more psychological studies done on this. This is a very sociological studies done on it. I
Hmm.
think this is an important phenomenon because have uh, we all want things instantly. So instant gratification is very, very important these days. Everybody wants. People don't have patience. If someone calls you on WhatsApp once and you don't pick up, it's all in. The person may call you five, six times. This is what happens, right? The moment they see blue tick, they want an answer back immediately. Even though you've seen the blue tick, you may be busy with something else.
Yeah.
So that is what is happening. Plus, our notifications keep distracting us all the time.
Hmm.
Um, our kids, uh, if they are not seeing videos, they don't eat the food. So they are
Hmm.
watching their phones and eating food, right? So
Yeah.
if you look at how the young kid, and if you look, why is that? If you have uh, the way social media is made and consumed, it's in a shorter format. It is a
Hmm.
very quick changing format. Uh,
Yeah.
People speak very fast in
Hmm.
videos. The visuals change very quickly. This is all to keep our attention glued. On
Yes.
as if on a flip side, when things are uh, when the video doesn't change so much, when there's not so many visuals changing, when somebody's talking calmly and quietly, or then that is turning people off. So we are becoming kind of ADHD there. Yes, the environment is playing a role there. So
Hmm.
what will happen is that, like I was talking about social anxiety and the environment,
Hmm.
similarly here also, uh, it'll affect much more to people who have ADHD.
Hmm.
Like people who are procrastinating, who have tendency to have ADHD, who
Yeah.
procrastinate because they have phones in their hand, they will procrastinate much more because they have
Hmm.
much more distractions available. So it becomes much more damaging for them. So
Hmm.
the role so our environment is doing right now is It's like, here's another example. Mm, people have, let's say, people have genes for addiction,
Mm-hmm.
and they have all kinds of drugs and alcohol and smoking. Everything is available with them. So the chances of people becoming addictive are much more high because availability is there. Genes are
Mm-hmm.
there, environment availability is there, environment is there, and it clicked, and now voila, you have an illness. Same is
Yeah.
this also. And
Mm-hmm.
hyperactive, so media, the
Yeah.
way we consume media, the genes are there and is activating and affecting people. Yes, definitely.
Mhm. Yeah. Yeah.
Dr. Vishal, we have received a very good number of questions. This is a very popular topic. Most of these are very lengthy questions. People have shared their life stories. So, and it may come out that a few of them may already have been covered in our discussion, but we'll still try to pick as many because people are looking for specific answers and we can guide them back to the discussion as and when needed. This is a question from a 27-year-old female from Mumbai. I've been diagnosed with both ADHD and anxiety, and it feels like they keep triggering each other. My ADHD makes it hard to stay organized and focused, which makes me anxious because I worry about forgetting things, missing deadlines, or not keeping up. But then my anxiety makes my ADHD worse because I get so caught up in the overthinking or panicking that I can't focus on anything. It's exhausting trying to deal with both at the same time, and I feel stuck in this loop. How can I manage these two conditions better? And are there specific strategies to help me break this cycle? Dr. Vishal.
Oh, what a wonderful, lovely question. I think this is the good. This is true for so many patients of our ADHD. Anxiety is very, very common, uh, and obviously they feed on each other. ADHD and anxiety. Wonderful, very wonderful question. I think this is going to help a lot of people. Maybe a three-pronged strategy: exercise, exercise daily. Okay, I think that is why exercise, because exercise helps us release trapped energy in our body, releases chemicals which makes us happy and healthy. Second, organization. Organize yourself. Maybe take help of a therapist, take help of a friend, or take help of another ADHD patient. These now we have online communities also. People may support each other. Organize and make yourself responsible for the stuff you do. You know, and third strategy. These are I'm talking about all without besides medicine. I
Yeah.
think meditate. Meditate. If you can't
Yeah.
meditate, pranayam, but meditation is very easy now with the guided meditations. So
Yes.
meditate, exercise, and organize. Organize
Wonderful.
with the help of a peer. Yeah, and obviously, if you say, okay, I've already done this, I'm still overwhelmed, take help of a psychiatrist, start medicines for both anxiety and ADHD. I would, for you, somebody like you, give an antidepressant which takes care of anxiety and also give a non-stimulant ADHD drug. These two I'll do. And after that, if you start these three things, you'll do much better because sometimes what happens, people say, no, I already tried meditation, Dr. Vishal didn't work. I already tried exercise, doesn't work. No, but maybe your mind is not as calm as now. Now, after the medication, now you can build on that. So I keep telling my patients, this medication itself doesn't help, and medications, but helps you reduce the stress to an amount, reduce the illness to an amount where you can manage.
Yeah.
Uh, it's like uh, it's like somebody is stuck in a well. You know, we need to give a rope, na, and pull it out a bit. Once
Yeah.
person is out to a large extent, the person can then pull themselves out of the well or out of the ditch. But we need to help with that rope and everything. So I think this is how it is. I look at it.
Beautiful answer. A lot of us, although are not that patient, but we can make use of what has been shared. This question is from a 28-year-old male, again from Mumbai. Uh, I'm a 28-year-old marketing executive in Mumbai. And for as long as I can remember, I've struggled with focus and organization. I often miss deadlines, forget meetings, and my desk looks like a tornado hit it. Okay, that's quite a visual version. I recently came across articles about ADHD and it feels like they are describing my life. But mental health isn't openly discussed in my family. They believe in toughening up. How do I approach getting a diagnosis and treatment for this, Dr. Vishal?
So, how old is the person?
He's 28-year-old male living in
So,
Mumbai.
so you are lucky because you are in one of the best cities where you have a lot of psychiatrists available. I think you should seek help of a psychiatrist uh, and get yourself diagnosed. Uh, Maybe a therapist also will help you because therapist will help you learn how, because medication may not teach you how to organize your desk. For
Yeah,
that, you need to develop strategies with the psychologist, sit down with a psychologist. You can do that with the psychiatrist also, provided psychiatrist has time. In
yeah,
India, unfortunately, we see 20, 30 patients a day, and it's not possible to spend 1 hour for each person, obviously. It doesn't make the
yeah,
math. Unlike in Western countries where you see 4 or 5 patients a day, then even a psychiatrist can see a patient like a psychologist. So you see a psychiatrist, get yourself diagnosed, start the medications if needed, and meet with a therapist and get yourself organized better. Learn why you're disorganized. बहुत बार what happens is कि uh, we the ADHD patients tend to accumulate everything, put a lot of stuff on the desk.
yeah,
Say okay, you say I'll only keep these kind of stuff which is required. Other which I've not used for maybe 6 months, 10 months, throw it off. Don't keep it on the desk. That will help you organize. So many times because you have this laziness to throw stuff, the stuff keeps piling up and you feel overwhelmed. So learn. There are strategies to deal with this. Don't be shy. You're 28. You're earning. Go meet with a psychiatrist and a psychologist. Get your plan ready and get out of this problem.
wonderful. uh, Accumulation is I think it's a very common behavior, not just for things but for things that are beyond things.
Hmm.
uh,
Yeah.
Not sure how
Hoarding.
to do that after that.
We say hoarding. Hoarding itself is
Yeah,
a disorder.
yeah,
Hoarding not just for physical stuff, but mental stuff also. Yeah.
yeah,
Maybe that's what you were trying to focus on.
yeah, yeah.
Hmm.
The next question comes from Chandigarh, 26-year-old male. He says, I have noticed that my tendency to seek out unhealthy dopamine seeking behaviors is becoming overwhelming. I find myself engaging in impulsive activities like binge eating junk food, excessive social media scrolling, and even trying risky behaviors just to feel some excitement. No matter what I do, I never feel truly satisfied and end up feeling unfulfilled. I'm starting to wonder if these behaviors could be symptoms of ADHD. Even though I haven't been diagnosed, how can I tell if this is related to ADHD? What can I do to manage these tendencies in a healthier way?
So, this is a difficult question to answer. I don't have enough
Mhm,
information. So I don't want to make guesses, but I'll just try and help this individual in terms of what I understood now.
mhm,
So, thrill seeking behavior can be a personality trait.
mhm,
Thrill seeking behavior can be part of ADHD also.
mhm.
Depends on the dysfunction it is causing to the individual. If a
Yeah.
person with ADHD, besides thrill seeking behavior or dopamine
Mhm,
seeking behavior, as you were saying, person will
mhm,
also have difficulty concentrating, difficulty sustaining attention, difficulty sticking with the job the
mhm,
person is doing. So those will
mhm.
be the issues with the ADHD person. And
Yeah.
there will be also a childhood or teenage history of inattention, hyperactivity, and impulsivity.
Mhm,
But and what strategies the person can do? Change the way you are seeking dopamine. Change the way you're seeking dopamine. One, try and
mhm,
deep dopamine detox. Maybe on a Sunday, keep yourself away from all gadgets. Read a
mhm,
book. It will be very boring, but still read a book. Maybe if you want excitement, then watch TV. Don't use the phone because phone is much more addictive than TV is. Phone is a
yeah.
two-way medium. You can communicate. TV you cannot communicate. TV is one way. You just receive. So read a
Mhm,
book, go for a walk. Spending time in nature really helps. which
Mhm.
we don't do it consciously but unconsciously. Why? That's why people want to rush to either mountains or to beaches. Why do we do that? Don't we have enough good parks in big cities? But the reason we want to do that is because we want to go close to the nature as possible. So
Yeah.
that's why nature is much more closer to us. I think this is why people want to run, to these places. And so spending time in nature helps you. So Chandigarh, beautiful place. He was talking with Chandigarh. I was thinking of the Chandigarh, of the lake there, the rock garden there. Such a beautiful garden around. So just spend time. Maybe go for a drive up to the Shimla
Mhm.
or lesser, or go to just Kandahar and or go to just Solan and come back. So he can go for uh, some kind of place where he can be with nature. He can detox himself by putting the phone away for a day or for at least 6, 7, 8 hours, and do some activity which also gives him pleasure. So that way, slowly, his brain will relearn to have pleasure from milder and smaller activities also. It doesn't need always the adrenaline junkie kind of activities. You don't have to jump from a cliff to get the excitement. You can just sit on a cliff and enjoy the view also.
Mhm. Yeah. I'll move on to the next question. This question comes from Pune, a 25-year-old female. She says, I'm in my 20s and recently started wondering if I might have ADHD. I wasn't the hyperactive kid growing up, but I have always struggled with focusing, feeling overwhelmed, and managing my emotions. I recently learned that ADHD can show up differently in women with more internal restlessness rather than obvious hyperactivity. That description really resonates with me. I'm confused because people say it's normal to feel stressed, but this feels like more than just stress.
Hmm.
How can I tell if it's ADHD and what should women specifically look out for?
Okay. Uh, I think for women, this internal restlessness is very, very common. So the way you can check whether this internal restlessness is affecting you is if you're doing the work
Mhm.
and your mind keeps getting distracted. You keep getting bombarded by unwanted, irrelevant, odd thoughts, which keep coming in, keep causing botheration to you, or
Mhm.
making you get distracted from the work you're doing. That may be a sign you may have ADHD.
Mhm.
Uh, so this is how a woman can. That's why, because in men you see much more physical activity. In women you see much of internal chaos or internal restlessness, as she was rightly mentioning. So if that is affecting her work to an
Mhm.
extent that she's missing deadlines. She's sitting down, she's okay, I need to finish this in 15 minutes, but it has taken 1 hour and she's still at the same place. She's getting distracted. Those dialogues, internal dialogues are coming in. That may be signs she may be having ADHD.
This question comes from Bangalore. Again, somebody is 29, male. Before going with the question, Dr. Vishal, I see most of the questions coming from a similar age group. So
Yes.
I don't know what's the correlation over here. We don't have any specific age group as a user. It's a much wider user base, but still, uh, I've been struggling with productivity for as long as I can remember, and now that I've been diagnosed with ADHD, it finally makes sense. I've tried so many productivity tools and methods, planners, to-do lists, time blocking, but nothing seems to stick. It's like my brain rebels against every system, and I end up procrastinating or feeling overwhelmed. The usual advice, like tackle the hardest task first, make a priority list, or focus on one thing at a time, just doesn't work for me. I really want to be productive, but it feels like I'm constantly fighting against myself. How can I manage my ADHD better and actually get things done when none of the typical methods seem to help? Productivity and Bangalore, I mean, it goes like that's a strong correlation. My bias.
So I think these are these are important but tough things to really answer, because I wish I had a single one-line statement for this to
Yeah.
help you. I don't, and I concede that. But he's saying he's tried all typical ways to deal with it. So try something atypical. Try atypical. Um, One of the strategies I've found to beat procrastination is to do a task only for 5 minutes and then drop it. Just for 5 minutes. So you said, okay, you have to make a PPT for your office. The PPT may require 3 hours of or 4 hours of work or whatever. So, okay, I will start the PPT. Just find what kind of template you want to use, write the title, write the name. That will take 5 minutes. Just do that, and after 5 minutes, just stop it.
Yeah.
Just stop it. Don't push it. So that you want, so this kind of strategy, what happens is it pushes the brain, fires the brain enough to do the task, but the brain doesn't feel the burden of carrying out the task.
Yeah.
Okay, so that helps. Second, uh, physical exercise, as I was mentioning before, and meditation helps in refreshing your brain. So meditation helps a lot. I think meditation is very, very important. I trust it a lot. It's a very good tool in today's life to balance yourself. We don't really know how it works, or science doesn't know exactly how it works, but meditation has been there for hundreds and hundreds of years, and it definitely. And now we have with apps, with guided meditations, it's always much much easier to do it, to get into
Yeah.
that groove, get into that thing. So 15 to 20 minutes of meditation every day helps clearing your thoughts, calming your mind, focusing you. And young people exercise. And young people don't eat too much junk food. Please eat some green vegetables and fruits also. This is very important. This doesn't have any direct correlation, but it will help you improve your focus. And use the strategy of fine, you prioritize, but use this as a strategy of doing something for 5 minutes and drop it. Another time, sometimes the brain works is if brain gets challenged to do something, then brain does it in a better way. So maybe if a friend can challenge you to try do this task, then maybe brain is more fired to do that. So you can try that
Yeah.
strategy also.
Yeah.
Okay, with a colleague.
I would, I'm not sure how clinical or how relevant that would be, but in my experience, how I have dealt with procrastination a good number
Mm-hmm.
of times is to commit that, you know what, let me just give at least 5 minutes to this,
Mm-hmm.
right? Because many a times things look much bigger than what they actually are, just because I've been postponing them. And this is my
Yeah.
experience. Now, it may not be
Mm-hmm.
directly relevant out here, but uh,
No, but
found
I
it
said
in
exactly.
time.
I said exactly the same thing, Aviral.
Yeah,
Exactly. You know? So once you try do it, you feel like you started it. It's always a
yeah,
starter trouble. So I think
yeah.
it's important to try that. There's
And
no harm.
on the meditation bit, I mean, when we started Omham started as a destination for meditations. That was our
Mm-hmm.
template for mental wellness that got transformed into mental health subsequently. So still we are one of the largest libraries of meditations and mindfulness content when it comes to accessibility. Anyways, let's going to the next question. This one is this question is from a younger person, a 17-year-old male from Bhubaneswar. I'm a student and I've struggled with focus for as long as I can remember, forgetting assignments, zoning out in class, and constantly feeling restless. After reading about ADHD symptoms online, I'm convinced I might have it because it describes exactly what I'm going through. But I haven't seen a doctor yet because I'm not sure how to start the conversation with my parents about this. I'm worried they'll just think I'm avoiding hard work or making excuses. How can I explain what I am going through and convince them that I genuinely need help to see a doctor for this? Dr.
This is
Vishal?
an interesting. This is.
Yeah,
Um,
yeah,
I think it's very nice to know that 17-year-old has realized that he or she he is suffering. He may be suffering from ADHD, right? So, Bhubaneswar is not a small city. I've been to Bhubaneswar last year, lovely city. Uh, and there are a lot of good psychiatrists there, I know. The way he should start the conversation is he says he can tell his parents that he's having difficulty concentrating on studies, and that despite his best efforts, he's not able to get as good marks, as many marks as he wants to or as he's capable of. This is usually happens with ADHD people. Their performance is below par, below their par, whatever they think they can do. So this
Yeah.
is a good conversation. No parent wants their kids not to have good marks. I think that will be a good conversation to have with your parents, and speak to first with the parent who's more accessible to you, maybe dad or mom, who's more open. You think is to, if both of them are not, maybe your sibling, elder sibling if you have, or maybe an uncle or an aunt who's more open to these kind of conversations with you. Maybe try through them and don't hesitate. If you feel, you can also show them some article, maybe by some psychiatrist in Odia, and teach them or help them understand about this. Don't. It's a good thing, young man. Don't give up and do talk to your parents and please seek help, and it will help.
The next question comes from Chennai. He's a 39-year-old male. He says that I was recently diagnosed with ADHD. While the medication helps me focus better, I'm struggling with a lot of emotions. As a father now, I feel frustrated thinking about all the years I was labeled as irresponsible or not serious enough. Growing up, I was always told to try harder, and now I realize it wasn't that simple. It was ADHD. I feel a sense of loss for the years I could have managed things better, and even some resentment and anger towards my parents, teachers, and myself for not recognizing it sooner. How do I deal with these emotions and move forward, especially now that I have a family depending on me?
So I think what he has described, this gentleman from Chennai, is very
Mhm.
common. This feeling of remorse, guilt, anger, feeling bad that why was I not picked up? Because they realized, oh, life could have been much easier, much better. I struggled so much. That pain of
Mhm.
struggling and people around you not recognizing and blaming you for what is not your fault is, very disturbing and very traumatic in a way. But for we have to forgive our parents, our teachers, because they didn't know enough. They didn't know well enough
Mhm.
to, to diagnose and to check it. You can imagine thousands and not thousands, I think millions of kids who would have been beaten over centuries for being indisciplined, but actually they were ADHD kids. You can remember, you can look at all that.
Yeah.
So I think we'll have to forgive our elders for not able to pick up. Thank God that you're only 39. You could have. I just recently had a professor coming to me at the age of 55.
Mhm.
I actually treated his kid, and his kid then brought him, and he's like, "Oh wow!" I mean, he's a professor. He's teaching, but he has ADHD. He could not teach properly as good as he wanted, and he was like, "Wow, I could teach so much better." And he had to do like half the effort to teach. So at the age of 55
Yeah.
also, he's thankful that he found the treatment and is okay. So be thankful that,
Mhm.
our average age is 80 these days in India. So, half your, before the half of your age, at least you're now, you can live a much better life. So I think you should
Mhm.
forgive your elders and you focus on this. But if you think you need to deal more with this, then a therapist will help you unwind your emotions, help you ventilate, and help you go through this journey of forgiveness and rebuilding yourself. So don't worry, best
Yeah.
wishes to you, sir, and you'll be okay.
The next question comes from Delhi, a 27-year-old male. I have struggled with maintaining healthy relationships because of my ADHD. I get easily bored and I often feel like I'm constantly chasing something new or exciting, even when it comes to my romantic life. There have been times where I have been unfaithful despite really wanting to stay committed. It's like I know what I'm doing is wrong, but the impulsivity takes over and I give in. How can I control these urges and break the patterns of seeking newness or excitement outside of my relationship, especially when it feels like it's tied to my ADHD?
Oh, this is a very, very important question. And this is usually the hidden part of ADHD, which is not
Mm.
discussed much. I think this is a very vital question. Uh, and he's so beautifully put that he wants to be faithful, but the impulse takes over. Now, that impulse is biological, and usually we do not have enough awareness to control it. So, mindfulness exercises helps us being in the present moment. So if you learn mindfulness, young man, and you with practice, you'll be able to pick up those impulses, those sexual impulses coming up in you, saying, okay, I want to have a new experience, or I want to try this. Then you may be able to put a problem, nip the bud, as they say, in and you can stop it right and there only. That will help. That can so mindfulness, being aware of the situation will help. If you can't, or you think that's difficult, then I think medication for 6 to 8 months or 1 year will help you reduce these impulses and stick on with the relationships. Also, see the circumstances which triggers this. Does it get triggered in certain specific situations? Does it get triggered if you're doing some substance use? Or does it happen randomly? So that also we needs to be looked into. And based on that, we should have a plan. But I think just being mindful, learning mindfulness will definitely help you throughout in other ADHD, I mean, other symptoms of ADHD also, and definitely this also. But medication can be used, and you can use the help of a therapist also if you have to.
Would couple counseling help in such a scenario?
So, besides the medication and the mindfulness, if he has currently a stable partner, he can take the partner also to the therapist. You can have a couples therapy where the therapist can teach his partner that how she can help him overcome these impulses and how he can track him and help him not to get outdone by these impulses. That also can be used besides medication and mindfulness and individual therapy. So couple therapy can also help in this situation.
I have a related question on that. That is it possible to be done with such impulses? It's like you're done. You've done it so much that you're done.
Yeah, yeah, that is a possibility. That is a
Risky
possibility
one.
that you uh, जैसे जो ओशो की टेक्निक है ना, ओशो तो यही कहता है कर करके थक
Exactly,
जाओ.
that's what was coming to
Yeah,
my
yeah,
mind.
I
That's
know, I know. But उस पे अभी हम नहीं जाएंगे यहाँ पे. Let's not get into that. Then person said, okay, let me do 10 more girlfriends and then I'll get bored with it.
yeah,
This is the message we're giving to the public. We don't have to do that.
yes. Okay, this was a beautiful segment, and Dr. Vishal, we've held you long enough. But there are two things we would want to know still. One is how did you come into psychiatry? What brought you into this? Uh, and what are you most excited about in the field?
What am I most excited?
About in this field?
Uh, okay, the reason I'm into psychiatry is twofold. One, my father is a psychiatrist. So from very early young age, I got exposed to psychiatry. But his psychiatry is very different from the psychiatry I'm doing right now. His psychiatry was more core psychiatry of schizophrenia, bipolar. We're doing much more
Yeah,
softer psychiatry, if you can say that, if I can use that word. So one, he. Second, when I used to read a lot as a young kid and I was very curious. So I realized the 21st century, uh, the two things which are left explored, one is the brain, another is space, you know. So space is so vast and brain is so vast. So I thought let's focus on the brain. So I have psychiatry related to brain. Uh, while I'm speaking with this, third thing I liked always was to help others, and I like to talk, interact a lot more. So it's a more of a
yeah,
social thing. In psychiatry, you,
yeah,
you tend to interact with much more socially in terms of with the patients. So social interactions I liked, brain I liked. My father's a psychiatrist, so I think these are three good reasons I joined psychiatry. And the second question, what excites me about the branch? is when people come and tell us that I've made their lives, I've changed their lives significantly. That's the thrill which makes me keep going. So that my life has changed so much because of you, and thank you. I think that's the thrill. Any doctor will have it, and I get it as a psychiatrist. You know. So this is the
One in
thing.
this brief interaction, one of the things that has had a deep impact, I would say, which is having a deep impact on me, is the relatability. I've talked to so many, and I've seen. I mean, what I see is that even when answering questions for people from Chandigarh, the most relevant places that can be there in Chandigarh were being talked about. So that was amazing. I mean, I'm sure our audience feels the same, and that also brings out the point that a lot of people who watch or hear this podcast, maybe on our app or even on any of the social media platforms, they would want to reach out to you. So, how can they? One is we would love to enable you on Omham, which we would do so that they can book a session as needed, right? They can book a consultation. But where all are you available? Where all can they reach out to you? And how open are you to these people? I'm sure you are. So,
Yeah. I practice in Delhi. I also do online consultations. Uh, I'm at Fortis. I go to Fortis Shalimar Bagh. This is where I'm HUD. I'm also in Fortis Basant Kunj in Fortis Okla on Thursdays and Saturdays. But mainly my clinic is in Rohini, where I'm there 5 days a week. I'm not there on Thursdays and Sundays. Other days I'm available. After this, I will be going to my clinic itself. I'm available on Insta. I do a lot of live where I answer people's questions. Insta handle is Dr. Vishal 2010, DrVishal 2010. I also had a website, but I think I'll be activating it again, drvishalchabra.com. Where else am I available as of now? This because I don't have enough time to do other stuff. So I think this is where I am currently right now. And I'm going to be with you guys on Oham as a podcast, and hopefully, uh, yeah, that's this is where I am.
anything, anything, irrespective of how deep and how interesting it is, if it started, it has to come to an end.
Yeah,
While from your ocean of knowledge and compassion, as much as we could pull out, we tried to, but it is not enough. And we can't, both of us, in fact, including my producer over here, we can't thank you enough for taking out the time, this long stretch that you sat with us, in fact, and all, I mean, all the inputs that we are trying to give to make the best video come out. I mean, we would love to host you, and we would love to convert this into a series as and when time permits you to be part of it. We would love
yeah.
to do that.
I had a lot of questions, and most I think I got answers to all of them, and this was a very satisfying session for me. I got a lot. I got to learn a lot of things.
Personally, for
Yeah.
me as well,
Hmm.
Thank you,
extremely
guys.
satisfying.
Thank you, guys. Actually,
This
I also learned a lot, and I realized I have to speak so much more. I've not spoken. I'm feeling I have not done
Yes,
enough justice to the topic. I think there's so much more to be spoken about, and that realizes, how deep the topics can go if you want to let them go. I think the topics are really
yeah,
huge. The vast area is very vast.
yeah.
yeah.
And to wherever you're watching this podcast or listening to it, do subscribe so that you can get more and more of this. And we will be sharing the link to for Dr. Vishal. He mentioned his Instagram handle. We'll be doing a collaborative Instagram live as well. So please wait for that. And thank you everyone for joining in.